Quick question. Do you suffer from restless legs syndrome? There's a lot of different advice on the internet on how to treat it. So in this video, I'm gonna be breaking down some of the top tips that have helped my patients and go into a little bit of science behind why they work. Hey everyone, I'm Dr. Michael Bruce, the sleep doctor. All right, let's start by explaining what restless legs syndrome is. It's also known as Willis-Ekbom disease, and it's a neurologic disorder. You happen to have these strong, irresistible urges to kick or move your legs, especially if it wakes you up, possibly accompanied by a little bit of itching or an uncomfortable feeling. Now, symptoms usually begin when your body is at rest or when you've been sitting or laying down for a little while. This is especially true at night, where symptoms also tend to worsen. I have some patients who can't even sit in a movie theater because their body is too still. Remember, restless legs sufferers will often keep their limbs in constant motion to either relieve or prevent these feelings. This is where that restlessness part of restless legs syndrome gets its name. And you can imagine that just before bed, if you're constantly moving, you're not settling down for sleep. Good news is, restless leg syndrome is not dangerous. But more importantly, left untreated, it can make sleep incredibly difficult. The unpleasant sensation of restless leg syndrome and the subsequent movement can make getting a good night's sleep very, very difficult. I think probably around 90% of people with RLS report at least one sleep-related condition. So you're in for quite a night. Now, a lot of people are probably wondering, well, okay, Michael, what causes restless leg syndrome? While many adults experience symptoms, no one's really sure what causes most of the restless legginess of restless leg syndrome. Now, cases that don't have a specific cause, which is most of them, are called primary RLS. There are certain cases of restless leg syndrome that do have an identifiable cause, and those are known as secondary RLS. Now, secondary RLS develops as a result of conditions including an iron deficiency. So as an example, I had one patient who came in to see me and we ran blood work. She was complaining of all this creepy crawly feeling on her legs. And of course, when we did a normal iron panel, everything looked fine. However, when we went just a little bit deeper and we looked at a type of iron called ferritin, we learned that while still within the normal range, it was below a metric that actually causes some of those symptoms. So you can even have normal iron and find out that it could be causing RLS. So it's probably worth a blood test at some point in time. Another thing that it could be is something called peripheral neuropathy. So peripheral neuropathy has a lot to do with what's going on from a circulatory standpoint down in your extremities, whether it's your hands or your feet. The big difference here is with restless leg syndrome, if you stand up and walk around, it goes away. With peripheral neuropathy, when you stand up and walk around, it doesn't go away. You can also see nerve damage outside of the brain and in the spinal cord that can give you symptoms that feel like restless leg. And also the big one, pregnancy. Pregnancy is actually a very well-known cause of RLS, but the good news is those symptoms aren't persistent and they normally disappear following delivery. Okay, well, how do we treat restless leg syndrome, like formally? Well, first of all, there are some medications that have been shown and well documented to be helpful for RLS. Let's go through some of them because there's quite a few. Let's start out in the prescription medication side of things. Believe it or not, the anti-seizure drugs have been used because it actually quiets down this movement that's going on in the legs. These drugs are often the first medication prescribed for restless leg syndrome and can help decrease both discomfort in the legs as well as nerve pain. The next are the dopaminergic drugs. Remember, dopaminergic agents are a class of medications that are mainly used to treat Parkinson's disease. I want to be clear, just because you got RLS does not mean you're going to get Parkinson's. But Parkinson's is a disorder that causes abnormal movements and problems with coordination and balance. So when taken at night, these medications might actually reduce the symptoms of RLS. Now, they may have some short-term benefits. Unfortunately, they seem to wear off over time. In addition, they can produce some unwanted side effects. Opioids is a third category, and a doctor might prescribe opioids to treat people who have severe symptoms and have not found success with other treatments. Remember, opioids are a class of drugs that are used to reduce pain. Even small doses of opioids may help relieve a person's symptoms, but they do carry a high risk of addiction. Next are the benzodiazepines. Benzodiazepines are a class of medication used to treat anxiety, muscle spasms, and other conditions. These medications have a calming effect and can help people sleep better. However, remember, benzodiazepines may be used as a last resort due to their side effects. Now, interestingly enough, there are also some supplements out there, non-prescription, that you can actually use that might actually help, because we think that some of RLS could be due to a number of vitamin and mineral deficiencies. I want to be super duper clear. Before you go running out and grabbing every supplement that you can find, you really want to do some blood work first. Talk with your physician and learn. Number one, have you got that iron problem that I was talking about, looking at ferritin? Remember, iron supplementation may help if the cause of your restless leg syndrome is because of that iron deficiency I was talking about. Only people with an iron deficiency should use iron supplements to treat their symptoms, as too much iron can result in iron overload, and iron overload is a condition that occurs when there's excessive iron in the body, which can actually damage organs if left untreated. So don't go run out just because you got RLS and grab some iron. Do your blood work. Another biggie, believe it or not, vitamin B1. Vitamin B1 helps make a chemical called acetylcholine, which is involved in motor control. In other words, B1 supports health of the nerves that control your muscles. So it makes sense that if you're low in B1, your legs are going to fidget. Vitamin B12 deficiency can also cause restless leg syndrome, and there's now some research to suggest that a magnesium deficiency may actually be the cause of some people's RLS. As my viewers know, I'm a big fan of using magnesium for better sleep, so it may be the one to look into. Now, also know that some antihistamines can cause this restless leggy feeling, so if you take one at night, it might be worth trying not taking it to see if it helps. Of course, talk with your doctor before you stop taking anything. Okay, are there any lifestyle factors? Believe it or not, there are. So one of the things that we've noticed is that when people are doing something that is very thoughtful before bed, it actually makes it so that this restless leggy feeling goes away. Crossword puzzles, word finds, Sudoku, any of that stuff done before bed, there's actually research to show that it calms the body down and it doesn't make those feelings of restlessness seem to happen so much. There are a few other obvious things, like less caffeine in your diet. Of course, less caffeine in the day is going to make you feel less jittery at night. Alcohol, believe it or not, is a bad idea. I know a lot of people would say, well, if I just have a shot or if I just have a couple of beers, that'll relax me, maybe it'll calm my legs down, and then I can fall asleep. Unfortunately, it tends to do the opposite for many people. In fact, many people have a tendency to notice the symptomatology more so after they've had alcohol. Nicotine is also a stimulant, and nicotine, just like caffeine, can be a real problem. So can high levels of sugar and high levels of salt. Now remember, proper sleep hygiene can make a huge difference in your sleep quality, as well as being able to help treat your restless leg symptoms. A few changes that you can make to improve sleep hygiene include, number one, and you've heard me say it a million times before, consistent bedtime and wake time. This way, your body actually knows when to go to bed. Especially with RLS, if you have a variable bedtime, your brain kind of doesn't know when to go to sleep. Another biggie, and this is gonna sound obvious, but I gotta be honest with you, so many people miss this one, a comfortable mattress. I tell people they need to replace their mattress probably about every 7 to 8 years. The problem here is as we get a little bit older, I'm 56 by the way, what happens is our body seems to not do as well on the mattress that we were able to use quite easily when we were younger. So do yourself a favor, look into things that have pressure relief from a new mattress. This can really help with restless legs. Also, maybe limiting electronic devices, maybe 90 minutes or so before bed. Remember, electronic devices can be pretty stimulating, which can make restless leg symptoms worse. One of the things that I actually found that can be very beneficial is a warm bath or shower, especially for folks with RLS. Maybe do even an Epsom salt bath. A lot of my patients tell me, oh, they love that. And with that lavender smell, you get a little bit of the lavender aromatherapy in there, and that can work out quite well. Also remember, restless leg syndrome can flare up after a poor night of sleep. So by focusing on getting better sleep tonight, you may actually reduce your restless legs tomorrow. By the way, if you really want to improve your sleep hygiene, check out my YouTube channel. We've put a ton of videos there every week covering all types of different ways that you can have a great night's sleep. So be sure to head over there and subscribe. Now, are there some exercises out there that could help? Believe it or not, there are. So I'm gonna give you a few that you can try. Not only may these lessen your symptoms, they may help be part of a great wind down routine to help you get good sleep in general. So the first thing you wanna do is massage your quads with your thumb and your forefinger. So squeezing on spots can help, especially if you can put your thumb deep into the spot where you're feeling the most kind of itchy restlessness. That's certainly one way to do it. Me personally, I love a foam roller for about 10 or 20 seconds on each spot. I know it seems kind of strange, but it really does help. As everybody out there knows, we've got a couple of bulldogs. I'll take the leash and I'll put it on my foot like this, and then I'll extend my foot and bring it forward. And what that ends up doing is it ends up really helping stretch out my lower quads, my hamstrings, and things like that. And that can be super duper helpful. And for folks out there who like to do a little bit of yoga, my favorite is a child's pose. This kind of gets you down and gets you relaxed and actually can help stretch out some of those areas that could be having a problem. There are a few alternate treatments out there. One of them is called a weighted blanket. Now, I'm sure you've heard about weighted blankets for anxiety and things like that. I'm not sure if there's any data to support it, but I gotta be honest with you, I think it's worth a shot. Weighted blankets can also help with anxiety, which can help deal with other problems when you're having restless legs. So if you're really at wit's end, a weighted blanket might not be a bad idea. I tell people to start out at about the 12.5-pound range and then slowly move up more and more. Also, I gotta be honest with you, topical CBD could be a good idea. I've got no data to support it, but remember, topical CBD does seem to help with inflammation and anxiety, so maybe using the topical CBD cream could be helpful. There's some products that they say help with restless leg syndrome, but to be fair, I haven't seen any data to support yet that they work. If you're gonna be looking at these types of things where people are specifically saying this helps with restless leg syndrome, you really wanna see, do they have any sleep specialists who've actually been looking at the data, and have there been any double-blind placebo-controlled studies? Now, remember, it's worth noting that restless legs can also cause anxiety, which on its own can have a considerably negative impact on sleep. Fortunately, there are a number of affordable, all-natural supplements that you can take that can help alleviate these feelings of stress and anxiety before bed. To learn more, check out my video right here. What have you used to help with your restless legs? I'd actually love to know. Do me a favor, send me some comments in this video, because if you know something that I can teach everybody else, it would be awesome. This is Dr. Michael Bruce, the Sleep Doctor, wishing you sweet dreams.